Welcome to the Food Revolution Summit, where we explore how you can heal your body and your world with food. I'm Ocean Robbins, and this next interview you're about to watch is with our guest, Dr. Marion Nestle. Marion Nestle, PhD, is an emerita professor of nutrition, food studies, and public health at New York University. And she's held faculty positions at Brandeis University and at the UCSF School of Medicine. Marion earned a PhD in molecular biology and an MPH in public health nutrition from the University of California, Berkeley. As a senior nutrition policy advisor, she edited the 1988 Surgeon General's Report on Nutrition and Health. Marion is the best-selling author of many books, including Food Politics and Slow Cooked: An Unexpected Life in Food Politics. A regular blogger at foodpolitics.com, her Twitter boasts over 140,000 followers, and she's been lauded by Time, Science Magazine, and The Guardian. Recognized repeatedly for her contributions, recent accolades include the 2023 Edinburgh Medal for Science and Humanities. In this interview, we'll be talking with Marion Nestle about food politics and how you can make a difference in our world with food. Marion, great to be with you.
Oh, it's lovely to be here.
I want to start by talking about food politics and food policy, topics you are very familiar with. Starting with the tobacco industry in the 1980s, trying to diversify its market share portfolio, got into the food industry. Tell us about that and how you think that legacy impacts food even today.
Well, the first question I always get asked is, what is food politics? Or what does politics have to do with food? Politics has everything to do with food, starting with the tobacco industry in the 1980s. The tobacco industry was selling products that were demonstrably, by that time, known to cause lung cancer. And so they diversified into food. They bought Kraft. They bought other food companies. And what was interesting about that was they used exactly the same techniques to sell food products as they had used to sell cigarettes. So one of the things the tobacco industry did was to develop what's referred to as the playbook. And the playbook was a series of strategies used to deflect attention from the carcinogenic potential of cigarettes. So the first thing you do is you cast doubt on the science. The second thing you do is you blame everything on personal responsibility. We're not forcing you to smoke. It's your choice. Right. We have nothing to do with it. Never mind the billions of dollars we spend on marketing. They bought their own science, so they paid for studies done by scientists who they paid. They criticized other scientists who came up with studies that showed that tobacco influenced lung cancer rates. And then they lobbied behind the scene. They paid for election campaigns. They bought members of Congress. The entire way in which the cigarette industry functioned was adopted by the food companies and used in the same way. So the first thing they wanted to make sure was that the food products they were making were so irresistibly delicious that you couldn't stop eating them. There was that famous Lay's
Bet you can't eat just one.
Bet you can't eat just one. And now, of course, we have really, really good research showing that indeed you cannot. And that these products encourage people to eat more calories without recognizing it. And so food companies adopted the same kind of techniques. And today you can say, and even though tobacco companies don't own the food companies anymore. They divested them. The companies are still following the same playbook and still doing exactly the same kinds of things. So, I wrote a book about how the food industry influences nutrition research by buying research studies and paying for them. And it's the most amazing coincidence. The studies that are paid for by food companies almost invariably show that their products are healthy, benign, don't cause problems, just like the tobacco industry did.
What is the impact of all this on public health?
Well, I think the impact of these kinds of strategies are to confuse the public. And all you have to do is cast doubt on the research and you're home free. Because then you can say, you can eat our products. There are, we're not saying you should eat our products exclusively. We're not saying you should overdose on our products, but just eat our products. Don't worry about it.
Yeah, moderation is everything.
Moderation is everything. And I'm guilty of saying moderation is everything, but I always say it ironically. Everything in moderation. If you could do it moderately, it would be fine. No nutritionist is the slightest bit worried about an 8-ounce sugar-sweetened beverage. I mean, really, you want a sugar-sweetened beverage at 8 ounces, fine, go ahead, enjoy. It's the 2 liters. It's the quarts. It's the gallons. It's the 8 ounces all day long
or even every day.
Or every day that everybody worries about. I mean, these should be occasional treats. They should not be part of the daily diet because they encourage overeating calories. And overeating calories means weight gain. Weight gain means a higher risk for type 2 diabetes, heart disease, cancer, overall mortality, bad outcome from COVID-19. And those connections are extremely well established. Equally well established is that these foods encourage people to eat more without realizing it.
Tell us about, from a public health perspective, how sick and unhealthy are we as a society?
Well, I'm always amazed to realize that 70% of American adults are overweight or obese. If 2/3 of the American adult population is overweight, that makes it normal. And, some astonishing percentage of children, 20 to 30% of children, that makes it normal. When I look at class pictures of children today compared to my class pictures or my children's class pictures, the difference is astounding. When my kids were young, there was maybe one child in the class, poor thing, undoubtedly the subject of terrible distress and stigma, but most of the kids were skinny by today's standards. Most adults were skinny by today's standards. And so it's no accident that type 2 diabetes and heart disease are leading causes of death among Americans. These are not very nice diseases, and they're preventable by, amongst other things, not gaining weight and being physically active and taking care of yourself. I mean, these things make a big difference.
We have some research coming out now that as early as the 1950s, the sugar industry knew that its products were causing serious problems to dental health and other issues, and tried to keep that research from getting out. Can you talk about that?
Well, yes, that was a discovery made by researchers at the University of California, San Francisco. Those researchers discovered that papers that showed that the sugar industry was perfectly well aware that sugar was a very, very strong, in fact, the strongest risk factor for tooth decay. But they did everything they could, following the tobacco industry's playbook to the letter, to deflect attention from that and to say that it had nothing to do with dietary issues. It had everything to do with toothbrushing, and you didn't need to worry about sugar. It wasn't a problem at all. And they funded their own research to demonstrate that that sugar was not necessarily a factor, I wrote the editorial that accompanied that particular study. And so I know a lot about it. And one of the things that amazed me about the research that these Harvard researchers did was that it showed a correlation of sugar to tooth decay and other health and heart disease, actually, that was exactly the same as the curve that showed that fat was related, that saturated fat was related to heart disease. But the researchers said that sugar had nothing to do with it and that it was entirely saturated fat. Well, saturated fat is still a risk factor for heart disease. It really is. But it exonerated sugar at the time, and it just was it a coincidence that that research was paid for by the sugar industry? They didn't really declare it at the time. They didn't have to at the time. So it was an interesting discovery. And that's why industry-funded research just confuses everything. And I remember I was working for the government in the late 1980s when an enormous report had just come out from the FDA exonerating sugar from anything except having to do with maybe tooth decay. And I've always wondered who funded that study. I've never been able to find out, or why that study interpreted the research so strongly as not having an effect on health, when we know that diets that are high in sugar are really not good for you, not only bad for your teeth, but they add calories that really don't help you.
Right.
And they make the foods that they contain irresistibly delicious so that you eat too many of them.
We all see so much marketing for hyper-processed foods, and some of it takes an interesting form. For example, Coca-Cola will sponsor sporting events. They really would like to encourage us to exercise more, right? And then get nice and thirsty, and then drink a Coke, right? Can you talk a little bit about the marketing tactics of the processed food industry and how it plays out and how it affects our psychology?
Yeah, I mean, food companies, I'm fond of saying that food companies are not social service agencies. They're not public health agencies. They're businesses. They have stockholders to please. They have to not only make a profit, but they have to grow their profit every 90 days and report growth. So they're in a situation in which they're required to have infinite growth. Not a very nice situation to be in, but that's the way our economic system works, and they're part of it. So their job is to sell more product to as many people as possible, as often as possible. And they do that by advertising, but that's only the most obvious way. For every $1 spent on advertising, there are $2 spent on everything else they're doing. And one way is to fund playgrounds, fund exercise, fund sports, fund, everybody would be healthier being more physically active. So it looks terrific that they're funding physical activity programs. Isn't that nice of them? And then when you get hot and bothered, you have a sugar-sweetened beverage to quench your thirst. They fund music people, because people love music celebrities, and you watch this music celebrities drinking Coke or Pepsi, and it makes you want to. They deliberately target low-income populations, Black and Latino populations. They market directly to children in every way they possibly can get away with. And then if they can't sell it in the United States, of course, they push it overseas to developing countries, and we export our obesity prevalence rates to low-resource countries. And they're really good at it.
So tell us about the marketing to children and people of color in particular, and how that is impacting public health in some of the communities that are most vulnerable.
Well, the marketing of sugar-sweetened beverages in particular to low-income Black and Latino populations is really complicated, because it started out when Coca-Cola, for example, was a white-only company, and it refused to either advertise in Black publications or to hire Black people into the company. And the Black community in particular organized to fight that, what they saw as discrimination. In fact, Martin Luther King, in his last speech before his assassination, gave a speech saying that his Black followers should boycott Coca-Cola because they weren't hiring Black people into the company. So that's complicated. And that was not a problem until obesity became a problem. And the prevalence of obesity is much higher in low-income Black and Latino populations than it is in white populations. And so now Coca-Cola markets and targets Black populations, and that puts the Black community in a very complicated position because that community had demanded this, got it, and now is suffering the consequences of it. And it's only in recent years that the Black community has started fighting back on this.
I was meeting with the senior vice president at Coca-Cola a few years back, and we were talking about what they used to sweeten Coke. And in the US, it's primarily high fructose corn syrup. And in Europe, it's actually sugar from sugar beets, non-GMO sugar beets. And I asked him why they use corn syrup here. And he said, well, it's cheap, right? Can you talk a little bit about the subsidies of commodities crops and corn syrup and how that plays out in the processed food industry?
Yeah, I mean, one of the things that food companies did in the early 1980s was to switch from cane and beet sugars, sucrose, to corn sweeteners because corn was subsidized by the government and we had a lot of it, and it was really easy to convert corn to a syrup that was sweet and nobody really can tell the difference. I mean, there's a reason that people can't tell the difference. They're both sugars, glucose and fructose. In corn sweeteners, glucose and fructose are separated. In sucrose, they're stuck together, but they're quickly separated. I mean, they're basically sugars. And corn syrup was much sweeter. Now that we are growing corn for ethanol as fuel for automobiles, it's not as cheap anymore, and it's unclear what's going on. I mean, the corn syrup dissolves better, so maybe they'll keep using it. But the point about all of this is that we have a commodity agriculture system in the United States in which nearly 45% of the corn crop is used as feed for animals. Another 45% is converted to ethanol for automobiles. And that leaves 10% or less as food for people. We don't have a food system that grows food for people. We have a food system focused on feed for animals and fuel for automobiles. And these commodity crops are subsidized by the government to the tune of billions of dollars a year. And that's what we're paying for. We're not paying for a system that's food for people. One of the great ironies of the American agricultural system is it's not about food.
And yet what is making its way to people is often making its way in the form of what Michael Pollan calls food-like products.
Food-like objects.
Right? And I think there was one study that found that Twinkies had 14 subsidized ingredients in it. Can you talk a little bit about the impact on the consumer of subsidized food-like products?
Subsidies have several effects. One is that they encourage the production of food crops in places where they shouldn't be grown. And corn is the best example because farmers get reimbursed with subsidies for growing as much as possible. The more they grow, the more money they get. They grow it everywhere, even if it's depleting water supplies and doing terrible things to the climate. So that's one thing. It kind of messes up the agricultural system. The other thing it messes up is the price of foods, because if corn and soybeans are subsidized, then they become very low-cost ingredients that the makers of ultra-processed foods can buy at very low cost, put into these ultra-processed food products that encourage people to eat so much, leave them on the shelf for enormous periods of time, and sell them at enormous profit. I mean, this whole system is designed to make profit for the food companies. It's not about public health. It's not about feeding the world. It's about making profit for food companies.
How does this impact the concentrated animal feeding operation system. Can you talk about how that plays in and how the economics of CAFOs are different because of the subsidized feed inputs?
One of the reasons why people can afford to buy meat is that the feed for animals is subsidized by the government. I already mentioned that 45% of the corn crop is feed for animals, subsidized, which means that the cost of feeding animals is much lower than it would be if the real costs were involved. And so that has encouraged the development of concentrated animal feeding operations, CAFOs, in which thousands of animals are lumped together in one area, polluting the environment, causing enormous problems. And the federal government is paying for this and we as taxpayers are subsidizing this because the farm bill subsidies go to feed animals.
And in effect, when we subsidize certain foods and food systems over others, we bring down the price of certain products on the marketplace. Can you talk a little bit to how this impacts the poor more than the affluent?
Another sort of basic thing to understand about the American food system is that it enormously overproduces food. So we have available in the United States today 4,000 calories a day per capita, which means every man, woman, and little tiny baby in the country has available 4,000 calories a day. On average, the population needs about half that. So that puts food companies in an enormously difficult position. They have to sell food, their products, in an environment in which there's twice as much food available as anybody needs. So what they've done is to develop a system that pushes food, that makes food available, cheap, and encourages people to eat more of it. And the government subsidy system plays right into that because the subsidies go to the ingredients of processed foods and to meat. And in a situation in which you really wish people were eating more fruits and vegetables. Now, the price of these foods then is lower as a result of those subsidies, although in a very complicated way, mostly because of overproduction. And what you really want is you want an agricultural system that's going to promote regenerative agriculture, that's going to put back in soil what's been taken out, and that's focused on food for people. Wouldn't that be nice?
Can you speak to how the poorer someone is, the more price sensitive they're likely to be, and the more the marketplace distortions are likely to impact them?
One of the results of the food system that we have is that the price of fruits and vegetables appears to be higher than most people or that many people feel that they can afford, particularly because they're perishable and some of it is wasted and that people don't want to buy them. If you're poor and hungry and you want calories, where can you get the best tasting calories for the least amount of money is the question that you're going to have. And that takes you right to processed foods. I was in Mexico recently, and the price of bottled water is either higher or the same as the price of sugar-sweetened beverages. That's a subsidy system at work.
Yeah, we see that in the US as well. It's stunning. Can you talk a little bit about how public policy is influenced by industry?
Well, there's a big disconnect between public policy and public health. And the reasons for that are pretty obvious. Let's start with election campaign laws that allow corporations to give as much money to people who are running for Congress as they want to and not necessarily have to declare it. So we have an enormously corrupt electoral system in which it is impossibly expensive to run for office. And legislators find themselves beholden to corporations for paying for election campaigns. The system is corrupt from the get-go. And until we change that, it's going to be very, very difficult to elect people who are interested in social welfare and public health and other kinds of values that I value, for example. And we see this play out in the amounts of money that these corporations give to legislators. And there have been lots and lots of studies demonstrating that these things are effective in having legislators being not quite so concerned about issues that might harm the people who are giving them money. I mean, we're human. This is very human. And poor people don't have money to give to candidates, so nobody cares about the poor. The people who are advocating for the poor are generally don't have as much money or power as the people who are ignoring them and wanting to take benefits away from the poor. And we see this throughout the food system as well as any other system.
Let's talk a little bit about environmental impact of food and the climate crisis. We're learning more and more about how the fossil fuel companies have known for a long time that their products were destroying the planet, but they kept that under wraps. Do you think something similar is happening with the agricultural industry, that particularly the animal products industry is having a significant impact on our environment and our climate, and most people don't even know about that? And is the industry in some way complicitous in keeping us in the dark?
Because I think one of the deep, dark secrets of the American agricultural system is that it is responsible for an astonishing level of greenhouse gas emissions. And this is something that, I think people just have no idea about. And there have now been many studies looking at the environmental impact of food production. And these studies invariably show that the single biggest contributor to greenhouse gas emissions is beef. And so much more. I mean, animal food production in general has a higher impact on greenhouse gas emissions than does the production of vegetable foods. But beef, far and away, is the most serious contributor because ruminant animals have this unfortunate habit of burping methane. And if you have a lot of animals in one place, they're burping a lot of methane in one place. And then producing an enormous amount of waste that has to be dealt with, and much environmental pollution is due to what happens with CAFOs, the eutrophication of the Gulf of Mexico, for example, and the Great Lakes, and all of these things are due to agricultural runoff, not only from animals, but also from the kinds of fertilizers and other kinds of inputs that are put on crops. And the agricultural industry has never had to curtail that, pay attention to it, or pay the costs of cleaning up the environment. I mean, what you see is that agricultural production, the current system, produces two kinds of externalized costs. One is the cost of cleaning up the environment from the waste and the air pollution and the land pollution and all the chemicals going into the waterways. So and taxpayers pay for that. The other, of course, is the health costs of what the poor diets produce. And those are externalized costs. Also in a situation in which we don't have a functioning healthcare system in the United States, and the costs of it are enormous, with not nearly as good a result as you get in lots of other places.
Let's go a little deeper on that. Can you tell us about the Medicare system in particular and the course we're on with the level of spending that our ill health is causing to taxpayers and the Medicare system as a whole, and where we're headed if we don't change course?
Yeah, I'm not sure I know. I have specific figures on that. I don't. What I do know is that if you don't have a private or a public healthcare system that covers most people's medical costs, somebody's got to pick it up. I mean, at the moment, we're not allowing people who need to go to a hospital to not get into it and die on the street. That's not yet acceptable, and I hope it never will be. But somebody has to pay for that, and the taxpayers pick up the costs. And so Medicare and Medicaid, which cover a great deal of costs for many low-income Americans and older Americans for sure. The costs of that are going up and up and up. Some people are living longer. Lots of people are living longer, fortunately, and their healthcare costs go up with age. And then for people who are unfortunate enough to become ill, the costs are astronomical. Because we have a private for-profit healthcare system when what we really need is a public, not-for-profit healthcare system. It would make an enormous difference.
Let's talk a bit about medical practice and healthcare practice and how that is influenced by industry. You would think that our doctors and our healthcare providers would be there to support our health, but all too often, it's more focused on treating the symptoms of disease. Can you talk a little bit about that dynamic?
Yeah, I'm in the healthcare system. I taught at a medical school, taught nutrition in a medical school for 10 years, and it was a real introduction to the way the healthcare system works in practice. And doctors are trained to treat disease. Prevention barely enters into it. It's just really, if you prevent disease, then doctors don't get paid because the system is set up so that what gets paid for is treatment. And so the entire system is organized to reward doctors, hospitals, and healthcare enterprise, for-profit healthcare enterprises, and without thinking about public health. I'm at my most cynical, I asked the question, what industry would profit if people were healthier? And I'm hard-pressed to think of one. Kaiser Permanente Healthcare, which is a not-for-profit healthcare system on the West Coast, is the only thing I can think of, or similar entities, but there are very few of those. Most healthcare in the United States is for profit, and therefore it's focused on treatment. And here you get into the drug industry, which works exactly the way the cigarette industry does in promoting its products. Precisely the same way. The difference between the drug industry and the food industry is that there's 50 years, half a century, of research on drug industry behavior, whereas research on food industry behavior is much more recent.
You just mentioned Kaiser Permanente as an exception, an outlier, because they're an HMO with a model where people pay a certain amount per month and then they get their needs met. So the company actually has an incentive to help people be healthy because that drives down costs, and increases profits, at least in theory. Can you talk a little bit about their model, but also what they've been doing to encourage health in their members?
I once met with a team of Kaiser Permanente executives, and they explained to me that roughly 90% of their costs, I may not have these figures exactly right, but 90% of their costs were focused on 10% of their members. And that what they wanted to do was to decrease that to 9%. And in order to do that, they have put an enormous effort into trying to do preventive health care. So my daughter, for example, is a member of Kaiser Permanente, and she is constantly bombarded by instructions to come in and do preventive health care. They're planting gardens around their hospitals. They're writing prescriptions for organic food. They're doing all kinds of things to try to see what they can do to get their membership to focus on healthy practices. Everybody should be doing that.
Yes. I'm a Kaiser Permanente member, and after any medical appointment, I receive an email asking if the provider talked with me about diet and health.
I'm stunned.
It's like a survey to check.
Stunned.
And obviously they're gathering data to make sure that their providers are including this in the conversation.
Yes, whereas because I live in a city that does not have Kaiser, I have private health care. And that means I get to see my doctor for 20 minutes maximum. And if I have anything I want to talk to the doctor about, well, it's not going to be about diet for sure.
Yeah.
So there's no time. You can't do a decent dietary interview in 20 minutes. It's not possible. You really have to work with somebody to find out what their particular food issues are. And if you're lucky, you go to a doctor who refers you to a dietitian or a nutritionist who can work with you about these issues. But the for-profit healthcare system is set up, so there's no time for any of that. You're in and out, and the doctor's on the computer the whole time.
You wrote an article a while back on the link between dietitians and the processed food industry. Can you tell us a little bit about that?
Well, there's a big issue right now about the role of dietetics influencers and food companies, because the Washington Post did an investigative report and discovered a bunch of dietitians who were flacking ultra-processed food products without mentioning that they had been paid to do so by the companies that make those products. And so this was a big story in the Washington Post, and it has elicited responses from the Dietetic Association that you're only talking about 7 dietitians, and our members are not doing this at all. But in fact, the relationship of the Academy for Nutrition and Dietetics and the organization that I belong to, the American Society for Nutrition, their relationship with food companies has been a source of observation and criticism for a very long time. I'm one of the most severe critics of both. I don't think that dietitians or nutritionists can make comments or give advice about what is good and not good to eat if they're being paid by food companies to say that really sugar doesn't matter. And I hear this all the sugar doesn't matter. Yes, you can drink soft drinks. You don't have to do this. You don't have to worry about obesity. You can eat anything you want. Lots of dietitians and nutritionists are saying things like this now, and they're paid to say it by companies that are either making products or that stand to benefit from that kind of advice. I don't think they should do that.
I think even another layer is we talk about direct compensation, but like the A&D actually invests in the stocks of processed food companies. So they're literally invested in the very systems that are making their clients sick.
Right. The Academy of Nutrition and Dietetics has had a long history of cozy relationships with food companies. If you go to their annual meeting, there are sessions that are sponsored by food companies. They have an enormous exhibit of products from food companies. The food companies are giving it away. And the code of ethics says some mild things about not being too influenced, but it's not very clear. And in particular, it doesn't say that you need to disclose who's paying you. You just have to disclose that you're being paid. That's really not good enough. And this is a long-standing complaint. And the American Society for Nutrition, which is composed of researchers who do studies on diet and health, they're forced by journals to disclose who pays for the studies and so forth, and have been for some number of years. So they do disclose, but in my experience, talking to dietitians and nutritionists about the issue of food industry sponsorship, they don't think there's anything wrong with it.
We've been talking a lot about the United States. Our audience is also global. Are some of these same dynamics playing out in Europe, in Canada, around the world?
Well, I'm just back from Mexico, so it's fresh in my mind. What's happening in Latin America around diet and public health is really exciting, because I think 8 or 10 countries now have passed laws putting warning labels on junk food products, not allowing cartoons on products that have too much sugar, salt, and saturated fat, not allowing advertising of certain products on television, eliminating junk food from schools. I mean, they're sort of one after another after another. They're enormously worried that their population is going to have a very high rate of type 2 diabetes, which is a terrible disease, requires lifetime treatment, and is preventable if for the most part, not totally, but mostly preventable if you don't gain weight. It's not that everybody who gains weight has type 2 diabetes, but among everybody who has type 2 diabetes, an enormous percentage are overweight or obese. So there's warning labels on food products. It's astonishing to see. You go into a supermarket and half the products have warning labels on them. The companies are fighting back. And one of the things they're doing is instructing the people who stock the shelves to hide the warning labels. So you walk down the aisles and you don't see them. Astonishing to see. They are also taking the sugar out and putting in, they're not allowed to have artificial sweeteners either in Mexico. There's a warning about that too. But the law specified a certain collection of artificial sweeteners and left out allulose and monk fruit. So the companies are putting monk fruit and allulose in so they can get around the law and put cartoons back on the packages that are marketed to kids. And the companies have gone to court and there are numerous labeling lawsuits that are currently going through the courts, and it's unclear how the courts will rule. Everybody's waiting to see how those come out.
Are there, speaking of artificial sweeteners, or let's just say low or no calorie sweeteners, what is your take on stevia, xylitol, some of the ones that are sometimes touted as being less problematic or healthier? Do you think they're an improvement?
Well, I don't, because, I'm who I am. And one of my food rules is never eat anything artificial. So they're off my dietary radar. I don't like the way they taste. There's something about them I just don't like. There's not much evidence that they do anything for obesity because it's so easy to compensate. They may help some people, but overall, there's not much evidence that they're helpful. They're a marker of ultra-processed foods. There's more and more evidence coming out of problematic results. I'm kind of astonished by it. There have been studies coming out on aspartame, on stevia, on, just sort of one after another of coming out of sort of correlations between use of these substances and bad health outcome. I think the jury is still out on it. But the direction in which the research is pointing is that really you're better off without them.
I want to ask you about Dr. Kristen Kearns.
Okay.
And the impact of her research. Tell us the story and what she found.
Kristen Kearns is a dentist who's now at the University of California, San Francisco. And when she was mucking around in some files that she had gotten access to, she discovered all these documents from the Sugar Association that documented the Sugar Association's funding of research at Harvard to demonstrate that sugar was harmless to tooth decay. And it was an amazing discovery because for years, dentists had been saying, you don't have to worry about sugar, just brush your teeth, use fluoride, whatever. It has nothing to do with sugar. And here, she had come across evidence that sugar caused tooth decay, causally related, not even associated, causally related, and it had been hidden in research that had been sponsored by the Sugar Association. So she wrote an article for JAMA Internal Medicine, and I was asked to write the editorial for it, which I did, and commented on it. I thought it was a terrific piece of work. And her study had 500,000 downloads. So 500,000 people read her study. It was the single most read article in JAMA Internal Medicine that they had ever had. It got enormous publicity because it was so shocking. So absolutely shocking that this industry knew that sugar was causing tooth decay and was hiding it and doing everything it could to obfuscate, just like the oil industry hid its relationship to climate change, just like The chemical industry hides its relationship to health and other kinds of issues. And just like the food industry tries to hide that ultra-processed foods are, make people eat more.
And just like the tobacco industry.
And what the tobacco industry did.
Yeah. What about pesticides in our foods? Is that something we should be concerned about for farm workers, for the environment, and for public health?
Well, I'm enormously concerned about pesticides and astonished by how little we know about them and how little attention they get. But it's one after another after another. I mean, one problem is we consume them in very, very small amounts. Unless you're a farm worker having them dumped on you, where you can really see results, and the results are not pretty. Most people eat them in very, very small amounts. But the studies that have looked at pesticides in the blood levels of Americans find them, everybody's got them. We all have them in our bodies. Children have them. How serious are they? Why isn't everybody studying this? And I think there's enormous industry opposition to these kinds of studies, enormous industry minimization of potential harm. I can't quantify the harm of them, and I've tried. I've read through the studies. There are plenty of studies showing that they're harmful. How harmful? How serious are they? Or should you be worried? Should you have your PFAS levels measured? And if you do have them measured, what are you going to do about them? Part of the problem is there's nothing that can be done about it. They're ubiquitous. So I think we should be doing everything that we possibly can to reduce the use of these chemicals in our food supply. They're not good for us, or there's no reason to think that they're good for us. How bad they are, I'm willing to say, is probably, we don't know. I'm willing to say that. But they're certainly not good for wildlife. I'm astounded at how little attention is paid to them.
Are organic and fair trade for those consumers who can afford it a good investment? And if so, why?
Well, I'm a real believer in organics. Organics are about production value. They're not about nutrition. They're about production values. And if we want a healthier environment that has fewer chemicals, fewer pesticides, fewer herbicides, we should be producing far more organic food. And we should actually not only support organics, but we should support the next step, which is regenerative, which means making sure that everything that's taken out is put back into the soil. I think that's what the Farm Bill should be supporting. Right now it has tokens. It needs much more than tokens. And that would make for a healthier food system. Fair trade is complicated. I love it in theory. In practice, it raises questions. Fair trade and all of the other seals, and there are dozens and dozens of them in supermarkets, seals that attest to non-GMO, fair trade. I don't know, I can't remember them. There's so many of them. These are all third-party, or most of them are third-party certified. And to the extent that third-party certifications are doing their job, they're really meaningful. And I think the good ones, and fair trade is one of those, trying really hard to keep the third-party certification as meaningful as possible.
And why is it important to support fair trade in our agricultural systems?
Well, fair trade guarantees that the producers of the foods are being paid better than they would without fair trade. So I think coffee is probably the most obvious example, is that the people who work on coffee plantations are among the poorest paid people in the world, and anything that could be done to move more of that money into for the people who are actually working and producing these foods seems to me a good idea.
Dietary guidelines. And what is recommended for the consumer, for the public to eat. How trustworthy are these? And are they in any way influenced by industry?
So your question is about dietary guidelines. Yes, they're influenced by industry, but indirectly through the members of the committees that write the guidelines. And the dietary guidelines have a long history of having the bulk of their members have consulting ties or other kind of ties with food companies. There's a new paper that has just come out that says that 9 of the 20 members of the 25 to 2030 dietary guidelines have ties to food industries. If that's true, it's the lowest level effort ever. You know, I mean, the dietary guidelines are a whole book in themselves.
Right.
And they're one of the things about the American ones that have come out since 1980, every 5 years since 1980, is that they get increasingly complicated and more obfuscating, and longer and longer and longer, even though they all say the same thing. I mean, they really haven't changed. I think dietary guidelines are so simple, and what to eat is so simple, that I'm fond of quoting the journalist Michael Pollan. Eat food, not too much, mostly plants. Really, that's all there is to it. You know, for food, you have to define food as something that's minimally or lightly processed, not ultra processed. But other than that, food, not too much, mostly plants. That'll do it. Enjoy your dinner.
We've been talking with Professor Marion Nestle, author of Food Politics and many other best-selling books, a researcher, a scholar, and a leader in helping create a sane and healthy food system for all of us. Marion, your decades of leadership are such an inspiration to me. I'm so grateful to you for your work, for your visionary leadership, and for telling us the truth like it is.
Thanks for having me here.